Welcome to the James Cook University Bachelor of Midwifery Modified Bondy Scale Guide for Clinical Assessors and information on how assessors can give consistent developmental feedback to support safe practice.
To begin, James Cook University acknowledges the Aboriginal and Torres Strait Islander peoples as the first Australians and traditional owners of the lands and waters on which our campuses are located. We acknowledge the resilience and strength of the Aboriginal and Torres Strait Islander peoples and pay respect to elders past, present and emerging. James Cook University is committed to advancing reconciliation and to embedding respect for Aboriginal and Torres Strait Islander knowledge, cultures and perspectives across teaching, learning and research.
The Modified Bondy Scale is a criterion referenced clinical assessment tool used to evaluate student performance in practice-based learning environments. The scale was originally developed in 1983 by Kathleen Noack Bondy. In midwifery education, the Modified Bondy Scale retains Bondy's original intent but uses updated terminology and clearer descriptors. The focus is on safety, effectiveness, professional behaviour and appropriate consultation, rather than a deficit-based labelling system. The Modified Bondy Scale is our standard framework for judging clinical performance. We use this framework across our MIDAC Midwifery Competency Assessment Tools, or MCATs, so that expectations are clear and consistent. It is criterion referenced, which means assessors rate students against explicit, observable standards, not against each other. This improves fairness and consistency across different assessors and placement settings. The scale is developmental. It recognises that competence in midwifery builds progressively as students gain experience, confidence and clinical reasoning. Students should be expected to move between levels over time, with ratings trending upwards as exposure increases. We apply the same Bondy framework across all MCATs. Using one approach everywhere aligns learning activities, assessment and feedback, and helps students understand expectations clearly. An assisted rating is appropriate and expected during the early and middle stages of the program. At this stage, students are generally safe, but still require frequent verbal and occasional physical directive cues to complete skills. This is a normal part of capability development. The scale helps us separate safe beginning practice from performance that is unsafe or requires a level of support that indicates the student is not yet ready to perform the activity with reduced supervision. That distinction is essential for safety, for targeted feedback and for planning learning opportunities. It is important to note that independence on the Bondy scale does not mean working alone. It means that student meets the professional standard without supportive cues, works within scope and knows when to consult. Appropriate consultation is a hallmark of safe beginning professional practice, not a sign of weakness. The Bondy scale evaluates student performance across three key criteria. The first criterion is professional standards for the procedure. This criterion focuses on safety, accuracy, and effectiveness. Effectiveness refers to achieving the intended purpose of the procedure, while affect relates to the student's manner, communication, and professional demeanour. Indicators include completing identity checks, explaining the procedure to the woman, and adhering to infection prevention principles and documenting care accurately. The second criterion is quality of performance, which reflects the student's level of skill development. This includes effective use of time, equipment, space, and physical effort. Competent performance is demonstrated by logical sequencing of steps, anticipation of required equipment, and efficient time management without rushing. Excessive energy expenditure, such as repeated equipment checks or unnecessary repetition of actions, indicates a low level of performance. Students should also integrate their findings into an appropriate plan of care. The third criterion is type and amount of assistance required. Assistance is assessed through the use of cues, which are categorised as either supportive or directive. Supportive cues provide encouragement such as well done or you are on the right track. Directive cues involve specific verbal instructions or physical guidance to prompt the student on what to do next or how to correct the technique. A 5-point rating scale is used: independent, proficient, assisted, supported, and dependent. The scale is not designed to imply that independence should only be achieved at the point of course completion. Independence reflects a beginning level of professional practice. Skills develop over time, and students may repeat assessments to demonstrate growth and progression. A student partway through the course may be assessed as assisted, which is appropriate and expected at that stage. Students will revisit the criteria later in the course as their learning develops. When deciding between independent and proficient, both levels meet the professional standard and both are safe, accurate, and effective. The difference lies in the quality of the performance. Independent reflects proficient performance, while proficient reflects efficient performance. Proficient students are fluent and practiced, whereas independent students perform effectively without unnecessary use of time or resources. The timeframes differ, with one being reasonable and the other expedient. The assistance required also differs, as independent requires no supportive cues, while proficient may involve occasional supportive cues. Both ratings indicate competence. When deciding between proficient and assisted, the professional standard is achieved most of the time at a proficient level. Quality of performance at the proficient level is efficient, coordinated, and confident. Assisted performance is often inefficient, lacks coordination, and requires more frequent intervention. Occasional supportive cues at the proficient level becomes frequent verbal and occasional physical directive cues at the assisted level. Between assisted and supported, assisted indicates that the student is skillful in parts of the behaviour and is safe, accurate, and effective most of the time, but remains inefficient and uncoordinated. Supported indicates that the student must be supervised, performs at risk, or is consistently inaccurate, unskilled, and inefficient, and requires continuous verbal and frequent physical cues. Dependent reflects a student who is unsafe, unable to demonstrate the behaviour, or unable to perform the skill. It is uncommon for a student to request assessment and be rated as dependent. Using the Bondy scale in practice involves making a judgment about the overall quality of the performance. Consider whether the student is skilled and coordinated, whether they understand what they are doing and why, and whether there is evidence of critical thinking. Assess confidence, composure, time management, and the ability to maintain focus on the woman or person receiving care. Confidence is an important consideration. Consultation is always appropriate and encouraged. A student may be confident in their skills while still seeking advice or input from more experienced practitioners. An essential aspect of independent practice is recognising one's limitations and scope of practice. Students must be able to identify what they can do safely and when they need to seek support. This is a critical professional skill they will continue to use throughout their careers. To assess and give feedback with the Modified Bondy Scale, start by using the Rating Plus targeted feedback to set the student's next learning goal. Anchor your comments to the 3 criteria that underpin bonding: professional standard and safety. Was the activity completed safely and to the required standard? Quality and efficiency. How coordinated, organised, and efficient was the performance without rushing? The assistance pattern. What type of cues were required? Supportive versus directive, and in what amount? After you determine the level, name the limiting criterion and set one action feed forward goal. For example, rated assisted because frequent verbal directive cues were required to sequence equipment. Assistance criterion. Next time, prepare and lay out equipment in procedural order, then verbalize the sequence before commencing. Keep feedback tied to criteria makes it clear, consistent, and focused on the student's very next step, and helps assessors across settings make comparable decisions. Behaviours to consider when doing an assessment is confidence, consultation, and independence. In midwifery practice, confidence includes recognising when help is needed. Students who show good judgment seek support when there is uncertainty or risk. This is safe practice, not a weakness. Consultation is always appropriate. Seeking advice early helps protect women, babies, and students and demonstrate professional responsibility. Independent practice means recognising limits. On the Bondy scale, independent does not mean working alone. It means meeting the expectation standard without prompts, working within scope, consulting when required. These behaviours align with the developmental intent of the Bondy's criterion referenced approach. The Modified Bondy Scale supports consistent and defensible judgment of student performance, with safety and level of assistance as a primary consideration. Professional standards come first. Assessment begins with professional standards, including safety, accuracy, effectiveness, professional behaviour, and communication. If practice relies on close supervision for safety, accuracy is inconsistent, effectiveness is variable, or professionalism is inconsistent, the rating cannot be independent or proficient. Safety functions as a gatekeeper. If safety is not met, higher ratings are not achievable, regardless of other strengths. The quality of the performance matters. Once safety is established, assessors evaluate how the task is performed. This includes sequencing, coordination, efficiency, and appropriate use of time and energy. If performance is safe but inefficient, poorly sequenced, uncoordinated, or prolonged, the rating should not be independent or proficient. In these situations, assistance should be considered, recognising that efficiency and coordination are essential for independent practice. The most influential domain is the level of assistance required, particularly the frequency and intensity of directed cues. Independent requires no cues. Proficient allows for occasional supported cues. Assistant supported and dependent reflect increasing verbal and physical directed input, with dependent indicating inability to perform safely without assistance. The frequency and intensity of directed cues is a stronger determinant of the final rating. Supported cues encourage reflection, while directed cues actively guide actions and reduce the achievable level. When assessing the Modified Bondy Scale, assessors must apply the domains in sequence, prioritising safety at all times, use observable performance, not effort or intention, and base decisions on assistance actually required, ensuring ratings are consistent, justifiable, and defensible. Remember, the Modified Bondy Scale is not a measure of effort or improvement. It is a structured assessment of safe, effective, and increasingly independent clinical practice, supporting fair evaluation while protecting patient safety.
So the key take-home messages is that the Modified Bondy Scale supports fair, consistent developmental assessment. It combines standards met, quality and assistance required. It uses a rating system to target the next learning goal. James Cook University wish to thank you for your support in developing and promoting midwifery practice in our students. If you wish to discuss any of the Modified Bondy Scale information further, please do not hesitate to reach out via our email account mpe@jcu.edu.au, as we can assist you on a one-to-one level if required. You will note some references regarding Modified Bondy Scale below.